Hi, my name is Cassandra, and this is all you need to know about marijuana, the effects on the body, and the effects it has on the brain. So, what is marijuana? Marijuana is a greenish gray mixture that stems from dried leaves, flowers, stems, and seeds from the cannabis plant. The plant contains mind altering chemical THC. There are three main types of marijuana. Cannabis sativa. It can cause uplifting and energetic feelings, appetite stimulant, and provides pain relief. This is typically what is used during a social setting. Second is cannabis indica. It causes body relaxation, stress relief, and calmness. It has a lower amount of THC compared to sativa. And lastly is CBD. It has the lowest amount of THC, which means it doesn't get you high. This is typically used in like ointments, creams, capsules, stuff like that makes the pain go away. The common street names for marijuana include weed, pot, Mary Jane, bud, and grass. Marijuana is typically consumed by joints, pipes, bongs, blunts, pens, and edibles, which is mixed in foods like brownies, cookies, candies, and even tea. For CBD, you can use it in creams, ointments, and capsules. Marijuana is the most common addictive drug after tobacco and alcohol. Recently, people at a younger age have started to smoke marijuana more. In 2018, more than 11.8 million people used marijuana in the past year. According to Monitor the Future survey, middle school and high school students remained at a steady rate, but kids from 8th grade to 10th grade have increased their daily use. The annual use of marijuana by college students has increased over the past 5 years. Among college students, 44% reported using marijuana in the year 2020 compared to 38% in 2015. Some side effects marijuana has on the body includes breathing problems. Smoke irritates people's lungs. People who smoke marijuana frequently may have the same breathing problems as people who smoke tobacco frequently. It also increases heart rate. It raises heart rate up to 3 hours after smoking, and it can also cause intense nausea and vomiting. Marijuana overactivates part of the brain that has the highest number of receptors. Some effects include altered senses, changes in mood, impaired body movement, and more. Marijuana can affect brain development. When teenagers use marijuana, the drug is impairing their thinking, memory, and learning function. This can affect how the brain builds connections between the areas that need to function. Long-term marijuana use has been linked to mental illness. It can cause temporary hallucinations, temporary paranoia, and worsening symptoms in patients with schizophrenia. Some main risk factors for smoking marijuana include brain health. Marijuana has been linked to cause permanent IQ loss as much as 8 points in younger people. It also affects mental health. Studies have linked marijuana use to depression, anxiety, suicide planning, and psychotic episodes. It also affects athletic performance and driving. People that drive under the influence can experience slower reactions, lane waving, decreased coordination, and difficulty reacting to signals on the road. There have been several studies that have linked serious marijuana use to having lower income, unemployment, criminal record, and more. Marijuana can also affect people's social lives. It can cause issues with memory, slowed reaction times, and anxiety. This isn't the case for everyone, but more research needs to be examined to see how much marijuana affects these outcomes. And that concludes my presentation. Thank you.